Now let's take a closer look at one of ISMRM 2016 scientific sessions looking at tumor response to therapy.
The title of the session is Tumor Response to Therapy, and the focus is trying to apply some of the latest MR techniques such as diffusion and DC MRI to understand tumor response, usually at the very early time points.
So increasingly what we're seeing, certainly in this session, is the functional imaging methods coming in as complementary method to simply looking at tumor size using anatomy.
So there's a number of different ways of looking at tumor response. Some are before we give or without contrast, such as diffusion weight imaging, but also some contrast-enhanced technique, such as DC MRI, where we inject gadolinium and look at how the contrast moves from the vasculature into and out of the tumor, and look at the vascularity of the tumor and how that changes in response to chemotherapy, for example.
So traditionally, we've really waited for the tumor to shrink as an indication of response, and we really want to get to the point where we're moving away from waiting for tumor shrinkage. We want to look at very early indicators of response to therapy.
A lot of these techniques have been around for several years, sometimes decades. The purpose of these sessions is to really discuss in the community, what are the latest ways of analyzing the data, improving on the sequences that we're already using. For example, for diffusion, we used to use a single p-value, and that gave a sort of very broad overview of how a tumor behaves. Whereas we introduce more b-values, which are representative of different strengths of the magnetic field as you progress through the diffusion measurements. You can look at individual compartments within the tumor, the little vessels within the tumor, the intracellular space, and these can provide clues as to more subtle effects of chemotherapy, for example.
I actually work on the preclinical front, and we absolutely think about how we can develop new imaging methods that will tell us about response to the newer therapies that are emerging. And so very often we'll be looking in the preclinical setting at therapies that are just entering clinical trials, really with this idea that we have a companion imaging biomarker that will tell us about early response to therapy.
We're also looking at new ways of analyzing the data. For example, you can look at the whole tumor and give a single number to represent a certain constant of that tumor. But increasingly in biology, we understand that tumors are heterogeneous. And to parse out that heterogeneity, you need more sophisticated analyses, such as texture analysis using one of these abstract, to really quantify how heterogeneous a tumor is.
You really want clinicians to know about emerging methods on the preclinical front and clinicians to be aware of the smaller size studies that are happening maybe in another institution so that different institutions can team up, ultimately really getting to multi-parametric, multi-modality approaches with large numbers of patients that we can think of as imaging indicators of response to therapy.
Sometimes going to SMRM is one of the best part of your research career. If everybody had their own technique of analyzing data, performing MRI, it would be hard to translate that to clinical practice when it's individual institution-specific expertise. But if we can resolve our differences, we can maybe bring it to a collaborator or a vendor to make it a commercial product that can really help a lot of patients.